Just we'll read together the mock survey questions, so we have to know what is the most common questions it will come during the round. They are asking about your infection control manual, so it will be available. You have to decide one area, you have to reach quickly to your manual, and you have to be familiar with the manual. If they are asking my manual, so I can bring and I have to put highlight with the common diagnosis in my area and the topics I am using in my area, so I can open quickly if they will ask any questions. This is our infection control manual. It is available in all areas with the nursing supervisors, and it is available with me as a soft copy. If you need to take, just send for me your email. I can send quickly, so you can download in your computer and you can open and you can read all the infection control policies. They are asking about the biological spill kit. We have a biological spill kit in all areas, so all the nurses, the doctors, the housekeeping, they have to know that we have a spill kit, and the first person will see the spill. For example, if the dental clinic, they have a spill for vomiting or blood or anything, so we have to know how we will manage the spill until the housekeeping will bring the spill kit. The nurse has to know the place of the spill kit, so can bring quickly, because the surveyor will count the time. If he asks you to bring the spill kit, how much time you are taking until you will bring the spill kit. So in your area, if there is a spill, you have to put the signs so nobody can enter the area, and you have to cover the spill with a blue sheet or whatever until the spill kit will come. Once the spill kit will come, you have to manage the spill as instructions and policy. So you have to wear the PPE first, then you have to put the treated sand, or you have to put the wooden pieces over the spill. Then you have to collect all of this in the yellow plastic. Then you have to pour the Clorox. The Clorox concentration, it will be 1 to 10. So you have to keep at least 1 liter measurement. So you can put 0.1, 100 ml Clorox, and the remaining 900 ml, it will be water. So it will be correct concentration. If you don't have patient on the area, so you can pour concentrated Clorox because of the smell. We are asking to put concentration 1 to 10, so to avoid the more smell it will come. This is the spill kit available on the areas. It is contain all the items used, PPE and Clorox and the wooden pieces and the treated sand and all the types of PPE. You will find the gloves, goggles, mask and gown. It will be available, and also the sign will be available on all departments to prevent anybody will enter the area where the spill it is. Our board, suppose it will be arranged. This is not accepted board, so you have to arrange your board to be good manner, and must be all papers must be laminated. Do you have a plan for PPE supply? I don't have a plan, but you have to take a plan and you have to arrange a plan for the PPE supply. This is for the all nursing supervisor. You have to get PPE supply. We have to make a flow chart. If we don't have PPE at any day, so what we will do? Simple answering, it will be I will borrow from other departments. I will ask the other departments if the storekeeper is on vacation or the storekeeper is not available, so I can arrange myself and I can ask another departments. Do you have routine environmental culture? No, we are not doing in Al Wafa Hospital in routine environmental culture. The CBAHI standard telling no need of routine environmental culture. So we are telling no, we are doing if there is outbreak or there is construction. The environmental cleaning log and the cleaning schedule, this must be available with the department, so they will ask you about the log. Okay, it will be observed and it will be, they will see this. Show me the equipment disinfection log and the curtain log. This one supposed to be on the area departments with the nursing supervisor. They are the one will answer, and the staff also will answer this one. We have a policy for changing curtains in Al Wafa Hospital. This policy of curtains, we have to change the curtain, send to laundry every 1 week for the critical area, and every 2 weeks for the wards, other departments. For the critical area as ER, in ICU, so we have to send our curtain to the laundry, and if it is dirty we have to send for cleaning, and we have to keep and document this one in a logbook. The equipment disinfection log, this one supposed to be available on all areas we have equipment. Staff rooming with the PPE, many staff we catch during our mock survey, they are wearing masks. This is not accepted at all. Please, the passing score, the scores will be reducted if you are doing any mistake like this. Please don't wear the PPE. You are using PPE for the purpose to protect you from the splashes, or for if you are doing any procedure. Not allowed to use mask and rooming in the hostel, not allowed to wear a gown or to wear gloves during rooming in the hostel. Staff coming with a scrub suit from home. We are asking all staff, please, if you are working in the OT theater, you have to be, sorry if I can say, we have to be honest, all of us. Honest, it means I have to change my scrub suit during my changing room. In the area outside, it will be not good. It will be spoiled with the dust, spoiled with the infection. Suppose it will be clean as possible. So I have to change the scrub suit inside the hostel. What about the immunization status? They will ask you about your hepatitis B titer. Must be, you have to memorize your titer. If you receive first dose, second dose, or third dose, so you have to tell us how many doses you receive and how much your titer. Okay. Do you receive influenza or meningococcal meningitis? You have to answer this one, and all of us supposed to be received, and we have to get the Bexel card. Bexel card supposed to be given for all staff. We have to receive influenza, meningitis. We have to receive the training of infection control, about the hand hygiene, wearing of PPE, and the safe injection practice, and also the fit test. It will be included on the Bexel card. All of these items in the Bexel card. Bexel means Basic Infection Control Skills license. So you have to get the card of the Bexel, and this one showing that you received already training and vaccinations and fit test. Do you receive orientation? Yes, I received the orientation on hiring. If I am coming new, I have to receive the orientation. Then the job specific orientation in my area to be updated every 1 year. So job specific, it means main topics you are using in your area. So we are receiving job specific orientation. All the staff sign about job specific orientation. If they forget or they don't know what is the job specific orientation, please contact me, so I will give you copy about your area department about your job specific orientation. So you have to memorize the topic to be discussed in your area. What is the main topics in the orientation? The main topics, we can say the standard precaution including hand hygiene, wearing and removal of PPE, safe disposal of the waste, cleaning, disinfection, sterilization, and the patient placement and the cough etiquette. This one is standard precaution. This is for all areas must be, but the main topics for the critical area like ICU, in ICU, sure, it will be the bundles. You have to memorize the items of the bundles. You have to read and memorize, because they will focus on in ICU, because we don't have ICU cases. So they will focus all the surveillance, the indicators, and the questions will be on the department of NICU, because we have only this area as a critical area at this moment can be detected. We can ask them about the bundles. What you will do if you are contact with exposed TB? What I will do if the patient came has open TB? If I know about the diagnosis, I must use the airborne precaution in 95, and I will place the patient in airborne negative pressure room, and I have to use the airborne precaution. If I don't know about the diagnosis I exposed to the patient, I have to follow the post-exposure prophylaxis management policy by informing my supervisor and inform infection control, and I have to go to employee health clinic for checking tuberculin skin test, and they have to do, it is the same name, Mantox test or PPD, it is the same, they have to do on the employee health clinic. When you have to change and discard the sharp container, Sharp container, there is a line. You have to discard if it is on this line. You see it is written full. This line 3/4. So I have to discard when it is 3/4 and if it is bad smell and if it is spoiled at the top with blood. Do you reprocessing single-use item? Never. We don't have reprocessing of single-use item in Al Wafa Hospital. Here, not reprocessing single-use item. Single-use is single-use, discard after use. We have a policy in the manual. Keep the next question, what's your procedure if you are using multi-dose vials? If I am using multi-dose vials at any area, xylocaine, insulin, Ventolin, so I have to do these steps. Once open, we must write date and time. Every time we have to use a new sterile syringe, new sterile needle. Every time we have to use a clean diaphragm by alcohol. You have to clean the diaphragm. Keep the vial in the refrigerator or according to the manufacturer instructions. Okay. Are you tested for N95? What's your size? Yes, I'm tested for N95. I have to remember, I have to be familiar with the mask. I have to bring the mask once he will ask me. Bring the mask, I can bring and I can wear. I have to do this one procedure. I have to train myself about my size. We have in Al Wafa Hospital 3 sizes, 1860, this is a green color. And we have 1870 and we have 1805. Only these 3 sizes we have in Al Wafa Hospital. So the fit test done about these 3. We have to do fit test in Employee Health Clinic. This one to be written on the Pixel card. Okay. And after wearing of the N95, I have to make sealing test. I have to make sealing. I have to check the sealing. Sealing, it means you are wearing the mask properly or not. If you are not wearing properly, it will be sealed. So you have to wear by correct manner and you have to close the metal on your nose and you have to put both of your hand on the mask and you have to push air. If there is leaking from the sides, it means you are not wearing properly because that's your size, what you got from the after test. So you are not wearing properly. You have to adjust to wear after checking of the seal. So check seal of the mask must be every time you are wearing the mask. If you fail to get the fit test result, will not enter the airborne patient's room. We'll do fit test by using Babar. This Babar machine, power air purified respirator. This one you are using if you fail to get the fit test. It will help you to work with the patient safely. Okay, it will give air. I think it is a machine giving air to during your work. We are applying to get this one. Still, we did not receive. I hope we can get early. How many types of isolation precaution? We have airborne, blue sign. We have droplet, red sign, and we have contact, green sign. Okay. This is the signs. It will be on the door and it will be on the file. Suppose if I have patient with the communicable disease, infectious disease, the order to be written by the doctor on the file, and this form it will be filled up. It will be put on the file. The nurse is responsible to put this form. We already gave a colored form for the contact precaution, droplet precaution, and airborne precaution for the supervisors. And if you need still papers, you have to contact us. But we gave all departments the contact for non-critical MERS-CoV. So we have a critical, it will be airborne, but non-critical, it will be contact. Will be for multi-drug resistant organism, for also the methicillin resistant Staphylococcus aureus, vancomycin resistant enterococci, and the wound infection. So you have to use this one. About the multi-drug resistant organism, we did not get any case about this one, but they are asking if you got any patient from another hospital, long hospitalization, you have to consider this patient as a multi-drug resistant organism patient. You have to apply contact precaution until we'll verify and until investigation result will come, will tell us he is not multi-drug resistant We have also a droplet precaution. This one, it will be more secretions. We have to use a surgical mask. We have to put a sign on the door, and this paper to be on the file, and the doctor will write the order, what is the type of precaution to be used, and the nurse has to write in her nurse's notes what is the types of precaution to be used with this patient. We are using for respiratory tract infection as influenza, adenovirus, meningitis, group A, streptococcus, mumps, measles, H1N1. This is the cases. Most common is influenza, mumps, measles. H1N1 also we got some cases, but we transfer to another hospital. This is common diseases in our hospital. We have airborne precaution. This blue sign, it will be blue sign on the door, okay, and it will be for critical MERS-CoV, critical cases of corona, chickenpox, pulmonary TB. Write the sequence of hand hygiene or hand rub. You have to train yourself about the right sequence of hand hygiene. Always we are talking about we have to do according to the posters in your area, so you have to train yourself about the right sequence of hand hygiene. What are the 5 moments? 5 moments, they're very easy to be remembered. Before touching a patient, after touching a patient, before clean or aseptic procedure, so we can say before aseptic procedure or clean, after body fluids exposure, and after touching patient surrounding. This is the 5 moments, okay? What is the hand hygiene compliance rate of you in your area last month? So you have to get the indicators about the hand hygiene compliance from the infection control department. For doctors, nurses, all you have to know about the hand hygiene compliance rate. This one, the November, we are showing for November by color. The compliance rate for nurses 78, for doctors and technicians 74, and for the auxiliary services it will be 65. This is the supportive services. This is your hand hygiene compliance rate. What are bundles used in your area? In our hospital we are using surgical site infection, VAB, CAUTI, CLABSI, multi-drug resistant. CAUTI, catheter associated urinary tract infection, CLABSI, central line bloodstream infection, multi-drug resistant, surgical site infection, and ventilator associated pneumonia. This is the care bundles. We have to fill up the form when we are dealing with the patient. If I am in critical area, so I am using the ventilator associated pneumonia. If the patient on ventilator, I have to use the central line bloodstream infection if insert central line, okay, and also I have to use urinary tract infection if there is catheter, urinary tract catheter. Do you have antibiogram? Yes, I have antibiogram in it is coming every 6 months from the laboratory. What is the commonest organism in your department? You will see the antibiogram. This is the antibiogram. This is isolates of microorganisms. So this is the sensitivity to the antibiotics, okay, number of sensitivity. So you have to get the report. If you need the report, we can send in your email if you want. This is a PPE. You have to train yourself about how to wear and how to remove the PPE, because they will ask you what is the first action, what you will do if you got needlestick injury. There is an immediate action. I have to wash my hand, allow blood to come out, no press for the wound, and wash your hand with soap and water, then dry your hand with tissue, then you have to take alcohol gel. This is the first action. So after the first action, you have to inform your area supervisor and inform the infection control, and you have to go to employee health clinic, okay, to fill out the forms, and they will carry out the situation. For also blood exposure, if you exposed for any blood exposure, also the same procedure you will do, remove contaminated clothing Okay, irrigate affected area by enough amount of water for 10 minutes, and you have to inform also area supervisor, and you have to inform infection control, and you have to go to employee health clinic. Okay. Result generating procedure, it's very important nowadays to talk about the result generating procedure. If you have one case suspected MERS-CoV, so you have to use the result generating procedure. What you will do, you have to wear N95 mask, you have to use the airborne precaution, and you have to place your patient in negative pressure room with the HEPA filter. Okay, this one as a protection for you. What is the procedures? It will be you have to do this precaution with, you have to do with the sampling, throat sampling, suctioning, CPR, intubation, extubation, and bronchoscopy. This one procedures maybe create splashes, so if you have suspect case of MERS-CoV or airborne, so you have to use the result generating procedure. Okay, especially we are writing for MERS-CoV because most of the cases nowadays is suspected MERS-CoV, but this one we have to use for all cases of airborne diseases. Okay, we have to wear N95, place the patient in negative pressure, and you have to use the airborne precaution until you will find out this case is safe or not. The last of our screen, occupational exposure. Okay, we talk about the exposure to communicable diseases, infectious diseases, TB. You have, if you exposed to any infectious disease and you are not protected, so you have to inform employee health clinic, inform infection control, and you have to go to the employee health clinic to take the prophylactic measures. The doctors there will talk to you, discuss the situation, and they will see how they will help you. Thank you very much. This is the most common questions maybe coming by the mock survey round.